Hello, my name is Dr. Patrick Grossmann. I'm a specialist orthodontist with a special interest in the treatment of temporomandibular disorders, or TMD. Are you one of millions of people who suffer from recurrent and chronic pain, tension-type headaches, migraines, head, neck, facial pain, ear pain, face pain, tooth pain, sinus pain, ear popping, ear clicking, intermittent deafness, vertigo, loss of balance? If so, you've probably consulted numerous healthcare professionals over the months or even years, and during the course of this time have spent hundreds, if not thousands of pounds. You've undergone numerous tests and investigations only to be told, "I'm sorry, we cannot find a cause for your symptoms." You've then been prescribed medication, usually amitriptyline or nortriptyline, and if that's unsatisfactory, you've been advised to try acupuncture, physiotherapy, Ayurvedic medicine, Botox, laser treatment, psychological counseling, CBT. The list goes on and on and on. Does any of this sound familiar to you? It's been my experience for over 30 years that many patients with the symptoms I've just described are in fact suffering from temporomandibular joint dysfunction, or TMD. What exactly is TMD? It is a musculoskeletal problem. It's orthopaedic in nature, and it's characterized by shortening of the head, neck, and facial muscles, together with displacement of one or both of the small cartilages within the jaw joint. So let us look at how the temporomandibular joint works in a little more detail. Here you'll see the teeth together. At this end, we have the jaw joint. The jaw joint is composed of the top of the lower jaw and the skull base, and between these two bones is this small structure, this yellow structure, which is the small cartilage within the joint. At the back of the joint is a space, and this space is extremely important because it houses nerves and blood vessels that supply this area. Not only that, but when this area becomes compressed due to dysfunction, then impulses are sent to the brain and the patient will experience discomfort and pain along the entire section of the nerve down that side of the face. This space here represents the ear canal. In normal function, the lower jaw, when opening and closing, will always maintain close proximity with the cartilage. It sits on top at all times, 24/7. However, when the cartilage becomes displaced for whatever reason, mainly trauma, having wisdom teeth extracted, motor vehicle accidents, whiplash injury, poor orthodontic treatment, to mention just a few, then in this scenario, when the patient bites together, you'll see that these red lines are no longer coincident and the lower jaw is pressing on the ear canal. By doing so, it compresses that space which was full of nerves and blood vessels, and this patient will experience discomfort and pain, especially on closing when this space is obliterated. So how do we treat this, and why is the treatment that I propose very different from most other treatments? The reason is very simple. We tend to treat the joint like an orthopedic physician or surgeon would. In other words, we want to put the parts back to where they belong so that the joint is now functional and structurally and anatomically correct. In order to do this, we fit the patient with a so-called splint, which is a small dental orthotic which fits over the lower teeth, very comfortable and very unobtrusive. And this is worn 24/7. And what the splint does is it brings the lower jaw into its correct relationship again with the cartilage, and therefore reconstitutes the space that previously was obliterated. And that space is now restored. This patient will experience reduction of symptoms in a very short period of time, and after some months, often the pain is totally alleviated. After this period of time, the patient will need some form of stabilization. So the treatment that we propose is different insofar as we believe that this treatment is therapeutic and actually gets to the cause of the problem, as opposed to palliative treatment, which just treats the symptoms with medication, acupuncture, and other adjunctive therapies like that. If you would like to know more about this treatment, please visit my website, www.patrickgrossman.com. Thank you for watching.